afternoon. It's Vince. In an effort to try to make sure we're improving our communications, we're trying to take this, and so I'm now going to do an executive summary for the past two town halls to try to help those that weren't able to join us to kind of get a sense of what we're doing, why we're doing it, and how we're doing. So today's presentation is really going to look at and talk about a couple key things. And the most important thing is everything we do has to tie back to our initial three goals that we've set for this year. And goal number one is that quality should be in everything we do every day in every service. Obviously, that's most true in our clinical services, but it's true for what our EMS staff does. It's true for what our MSAs do. It's true for everybody in the facility. If we are to be successful and to sustain ourselves into the future, we absolutely have to put our veterans first. We have to meet their needs. We have to exceed what community does so our veterans know that we care and value them. And we all have a role in that, so that's one. Two is we've agreed that we've got to make this a preferred place for our employees to be. We want this facility, we want Wilmington, which includes all of us, to be a place that if you're out on a Saturday night with friends and you're talking about employment opportunities, you would recommend us as a place for your colleagues and your friends to come and work. And then lastly, that we're a just culture, that everything we do is really about fairness, openness, transparency, and an ability to tolerate difference that helps us move forward in supporting the first two goals. So to that end, the three things I'm going to focus on today, and there's a couple other little important initiatives that I'll encourage you to peruse the PowerPoints to get more information about them. But what I'm going to focus on is the growth that we've had over the last year, our all-employee satisfaction survey, and then equally important, the information that we have from our veterans about how they perceive access here, as well as how they perceive whether or not we care about them. So let me talk about the all-employee survey first and foremost. We made great progress from 16 to 17. In 2016, sadly, we were rated the second worst facility in all of VA. We were not a desirable place to work. In this past year, thanks to your efforts, we've made substantial improvement. We're no longer in the bottom 10%. We had the best improvement rate of any facility in the network, and now we're continuing to make progress. We had some of our services really exceed and do extremely well. Services that made the most improvements from 16 to 17 included medicine, human resources, facilities, engineering, and what was the other one? I'm trying to think real quick. Radiology, all made dramatic improvement. In addition to that, quality was the top-rated facility throughout. I'll be providing information in much more detail later this month to supervisors so that each work group, and we had 53 work groups, that you'll get the detailed information about how your work group did. And the idea is that as a result of all this, that we would be able to pick goals and really use those goals to continue to drive positive change throughout this year as we go forward. So that's the focus of the all-employee survey. I would tell you this, as we looked at some of the written-in comments, many of you had talked about some concerns in how we function, and it ties back to those three goals. How do we look at fairness? How do we look at the distribution of work? And how do we continue to make this a better place for our veterans and for each other? To that end, I wanted to spend a little bit of time talking about what has been the growth in the last year and what have we done to expand the FTE to make this a place where the workload is distributed a bit more evenly. And we've made great progress. We've gone from, in 2016, roughly, we started the year with 912 employees. We ended the year with close to 1,000. Right now, we have 1,039 FTE on board. We've grown in both clinical areas as well as in the support areas. And just to give you some ideas, and I apologize, but it's hard to keep all this in my head. Some of the growth in the clinical areas, just to give you an idea. Providers, this is physicians, nurse practitioners, PAs, we were a plus 17. Mental health, which was an area that we had to make changes. It's a high priority for VA across the board. So mental health and social work, we were a plus 26. In nursing, and this is nursing that are our RNs, our LPNs, our nursing assistants, those that are directly performing nursing services, not other positions that have nurses in them. These are positions that were directly nursing services. We were plus 31. We were plus 13 in pharmacy and a plus 4 in EMS and a plus 12 for our MSAs. So you can see we've made tremendous strides in growth in the FTE. We've also made some growth in the number of veterans we see. We went up 4%, the highest again in the entire network. And we went up about 8% in the numbers of encounters that we provide. Last year we provided close to 225,000 encounters throughout our facilities. So it's very clear people are working hard. I think the challenge is how do we work smarter and how do we work in a way that helps people feel valued, helps people feel productive, and helps people feel supported. Because what we heard in the all-employee survey is that there were some challenges. Having noted all that, I have to tell you that 2018 is going to be a little bit tighter budget year, and that if you look at all the growth that we have, moving from 912 to almost 1,039 employees, we're still hearing that we're understaffed and that we need more support. And many of you feel that some of the hires weren't in the right areas. So one of the exercises we're now undertaking is we're meeting with all the services to go over their FTE charts and kind of get them aligned so that we have supportable organization charts for every service in the organization. So over the last 2 weeks, we've been meeting with the services, and rather than us saying, you know, here's what we think your FTE is, we're asking the services to give us what are their essential hires, their essential personnel that they need to be successful in this upcoming fiscal year. We're then using that information, aligning it with the agency's strategic plan, with our strategic plan, with the budget to set the priorities, and then get back to everybody to say, here are the key hires that we need to make throughout the rest of this year to be successful, and here's how we're going to go forward so that we're both fiscally accountable as well as staying focused on a veteran-first approach to care. So that's very much underway. We're very appreciative of all the hard work that went into that, and I think this will now begin to move us forward with a business acumen that matches the quality that we want from a clinical perspective and gives everybody the transparency and the input they need on how we move forward. So that's a key thing that we wanted folks to know and to talk about. The other thing that's key when you look at all this, and again, I bring you back to our 3 things, putting the veteran first, making this a better place for our employees, and having a just culture, we got to go back to, are we doing what we need to do to make sure our veterans have good quality service and that they have ready access to those services? So I've spent some time in the town halls giving data, and I've gone to the web page that's out there, and all of us can go. This is a web page that was created by Dr. Shulkin in VA, where somebody can go to www. You changed that on me, can you? www.accesstocare.va.gov. So again, that's www.accesstocare.va.gov, and you can see the data. And what it does is it looks at a couple things. The first thing it looks at is, do we have timely access to primary care and to specialty mental health care? And it gives information about how well we're doing for both new patients as well as established patients in those areas. And you heard me talk about the growth, 4% growth, 8% growth in encounters. We have done fairly well in access. New patients can be seen within 30 days. Established patients are being reset and re-seen within 7 days. We're pretty consistent across the board. We want to get that number down even lower, and we want to make sure that every site has the capacity to do same-day services, which we said we are doing. We're checking to make sure that we're doing that, so that, again, we have to keep access front and center in everything we do, both in our primary care, our specialty care, but most importantly, primary care and mental health. And so that's moving along quite nicely. The other areas that they talk about is how do we compare to the community, both around access, as well as in the way in which veterans perceive that we care about them. And in access, we're a little bit lower than the community standards. Folks believe facilities like St. Francis or Christiana or for our sites that practice over in New Jersey, that your Shura Memorials, your Atlantic Care, and your Inspira do a better job around access. So we need to really be looking at our practice patterns and making sure that we're able to see veterans when they need to be seen and that we have the ability to engage them. Equally, concerns that have come out of some of the reports, both from the Secretary's webpage as well as our sale data, which really looks at our quality performance, it looks at comprehensiveness. And that's how does the veteran perceive us in the way that we deliver our care, and do they see us as being empathic, concerned, and really putting them first? And the data that comes back from that is a little bit disconcerting, where again, they don't always necessarily see us as doing or meeting their needs or listening to them when we engage them. So we have to make sure that we're doing that and that we're looking at our practices in each and every one of our clinics that really does truly put the veteran first. For the most part, we're underperforming at the national level as well as the division level. We do have 2 clinics that actually are doing a little bit better. Our Dover clinic as well as our Cumberland clinic are exceeding the national as well as the division standards for engagement and a sense of where the veterans really truly feel valued. But our other clinics are coming up a bit short. So we need to make that a priority. We need to make sure that it's very clear in everything that we do that the veteran feels listened to, cared about, and that they're getting their needs cared for when they present, that we're addressing the presenting problems, and if there's the need to coordinate the care, that we're doing that. A real focus that I'm asking for all of us in the clinical area is to make sure that we do take ownership, that it's very clear that if a veteran presents with a concern, that we're handling it, we're walking them through that until the issue is resolved. And that we have a relationship with our veterans, that we know who they are, we know what their needs are, we're following up, we're closing the loop to ensure that they feel good about what they're getting. Again, the mandate from Washington, very clear, is if we want to remain relevant, we have to be as good, if not better, than community standards. So that's something that we need to look at, and the sale data right now in comprehensive performance indicates that we're doing okay in 2 sites, but the remainder of our sites really do need to push forward in the primary care area to make it abundantly clear to our veterans that we care about them, that we're listening to them, and that we're following up on what their priorities are from a treatment perspective. So very important things that we need to stay focused on. So everything I talked today is really kind of focused on making sure that those 3 goals that we've set together get actualized on a day-to-day basis, that we do put the veteran first in everything we do, and that it's very clear to the veterans that they're first, that they're our priority, from the time and the way that we answer the phone, to the cleanliness of the facility, to the way we greet them when they come in, and to the way we take care of them when they come in, whether it's from an inpatient perspective or from an outpatient perspective. That's goal 1. Goal 2 is we have to work together. We have to do a better job of listening to each other. Leadership has to do a better job of listening to the employees. We have to promote fairness, and we have to look at how do we work smarter, not harder in some areas, so that it is a more rewarding experience for all of us. And that lastly, that fairness, that equity, that transparency, and the communication is such that you would want your colleagues, your friends, to kind of work with you here in Wilmington. And our veterans can see that, they can feel that when they walk in the door, when they get the care, or when they pick up the phone to make an appointment. So there are some of the key things. What you'll also see in the presentations is information about suicide prevention. Again, a high priority goal. We've talked about that at every meeting. We'll continue to do that. There's also a link that you can use that will get you to a public message about Be There, making sure that all of us own the issue as it relates to suicide prevention among veterans, and that VA and community are working together to make that a high priority. The other key thing that I wanted to bring to your attention is we're making some changes in how we're putting in our time and leave. We've talked about this in the past, but on January 15th, we're going to go live with a new system where we will put in our time and leave. It will require some changes. Training will be set up pretty much from the end of January through the end of December through mid-January. Getting everybody ready and having some support for when the system goes live on the 15th. More to come on that, but please pay attention to it. It's really critical that everybody is paying attention to that. And the last thing that I want to bring to your attention is that there's new VA policies as they relate to life-sustaining treatment decisions and initiatives. We're underway to implementing that. It's going to require some documentation changes. It's going to require the way in which orders are looked at and updated on a regular basis. And throughout VA, this has become a priority for our veterans with respect to life-sustaining treatment decisions and initiatives. We're in the early phases of implementation, but us as providers, our MSAs, our eligibility folks, everybody needs to know about this because it is really going to change the way we practice. Last but not least, we just finished this flu campaign. The good news is 96% compliance by all our employees. We are expecting a tough flu season, so again, it's never too late to get the vaccine, and being preventative makes good sense. Hospitals are places where there are germs. We do a great job of trying to eradicate that. But it is a difficult environment, so it's really important that one is vaccinated or taking the necessary precautions to mitigate the likelihood of getting the flu this year. Much more to come. I think we've had a good year. We still have a long way to go. I appreciate the great efforts that everybody have made, but I think the information that we're getting back in our quality reports, in our veteran satisfaction, and in our all-employee satisfaction, it shows that we can do better. We still have a lot of work to do in cultural change so that our veterans feel valued, that our employees feel valued, and frankly, that we are giving quality in everything we do in every day to make this a better place. Thank you for your contributions, and we'll continue to work hard to make this a better place. Have a good holiday, everybody.